What this identifies is that actually our understanding now of why Wnt β-catenin signaling has different effects in melanoma tumours could be potentially dependent upon PTEN expression. So what we'd like to do is some more clinical studies to try and understand whether or not, if we look in a large cohort of patients, whether or not PTEN expression, if it's high and there's high levels of Wnt β-catenin signaling, could actually be a good prognostic marker for outcome for patient survival. This work could actually, in the future, if we take it on with more clinical studies, allow us to try and understand how we could intervene with specific drugs. So there are a number of drugs that have now been developed that are in clinical trials for Wnt inhibition, and it's difficult to know how to use those drugs in the treatment of melanoma, given that there's these controversies in the literature. So it may now indicate to us that actually patients that have low levels of PTEN, where Wnt β-catenin signaling seems to be promoting a pro-migratory and metastatic phenotype, that those drugs could actually be introduced into those patients. So PTEN may be a potentially useful marker for intervention with Wnt inhibitors.